Today's topic is if you have back pain, why you shouldn't wait to get treatment. If you wait, it could cause you more trouble. You've heard this before, but today is about why. We do case studies every single day, and the reason we do case studies is because we want you to identify these patients and how it relates to your problem. You don't know what type of treatment is best for your condition. Our goal is to help you identify which treatment is best for you so you can make better healthcare decisions. So we educate you through our case studies. We educate you through our case studies early in the day, and at night we do a little bit more of the science. But today's case is 156, and we do have 1,000 cases now, 1,000 case studies that we put together, and we're working on more every day. Our goal is 10,000. Originally our goal was 1,000. We hit that last week. Now we're going for 10,000. So a 57-year-old female with back pain and sciatica. Here's her key right here. She'd had it for 5 years. And in this length of time, we've talked about this in the past, the length of time you've had the problem is in direct proportion to how severe the problem is. Again, it's dictated through our case studies, 1,000 of them. Why? Because of the degenerative cascade. The longer you have the problem, the more breakdown you get in the disc, the more breakdown you get in the bone, and the more breakdown you get in the joint, which ultimately will start to pinch the nerves as the nerves exit through this opening here called the foramen. It's a lot like having a cavity in your tooth. The sooner you find out about it and fix it, the better the results are. If you wait till the tooth is so bad there's nothing you can do, then it's too late. Same thing with the spine. This is the number. This is her number. 5 years. It's maybe not quite our average, but for her it was a lot of breakdown in that 5-year period. And the breakdown had led to a lot of different problems. Before she saw us, she saw 3 different doctors. She had an MRI, she was taking narcotics, she had done physical therapy, and had taken 3 cortisone injections directly into her spine. That's important because these therapies had not solved her problem. So we know that for her particular case, these therapies, the outcome wasn't very good. Matter of fact, the consequences of narcotics are you get addicted to it. That's a pretty severe problem. Okay, you don't want to get addicted to narcotics. They're highly addictive. 80% of all our patients before they come in to see us were taking narcotics. Okay, it unfortunately is the treatment of choice that doesn't really solve the problem. Patient came in, we have a 9-step process. We've been doing this for 23 years, coming up on our 24th year, and we know there's 9 specific things you have to do to solve your problem. We've isolated these exact 9. We have an exact system to solve these exact 9. When you do this, you get better. It's not a miracle, it takes time, but it does happen. So when she came in, she had spondylolisthesis. We know that's a degenerative disease. She had degenerated disc, that's obviously a degenerative disease. Bulging disc is like having a flat tire, degenerative disease. And stenosis. These 4 are probably the most common degenerative diseases of the spine. She had 4 of the 5. There's 5 causes. The only one she didn't have is a herniated disc. Okay? All causing her sciatica. We have a video on the 5 different causes. You can take a look at that. Spondylolisthesis, shifting of the vertebrae. It's a slow breakdown over time. Same thing, degenerative disc. Degenerative disc should look like this, looks like this, getting smaller, pinching the nerve. Bulging disc, pushing into the spinal canal, causing a pinching of that nerve. Stenosis is a narrowing. It's a narrowing in and around the spinal cord, and it's a narrowing in and around the spinal nerves, all causing the sciatica. It's a degenerative cascade, slowly breaking down, just like your tooth, slowly breaking down. When she started our program, her pain was a 10 on a scale of 1 to 10. She was in bad shape, and she tried those 4 other things. She tried the narcotics, the injections, physical therapy, and other anti-inflammatories. Her oswestry was a 54. Oswestry Disability Index is a scale from 0 to 100. It's patient-reported outcome. This is the patient saying, I got better, I didn't get better. This is how severe her disability was. Surgical candidate. Anytime you're in that range for a long period of time, you are a surgical candidate. 58 treatments. Here's the lesson today. It took a lot. It took a lot of treatment. She had a severe problem. Doesn't go away overnight. Okay, absolutely 100% a candidate for surgery. Chose not to have it. She's better off because of it. Okay, we got her pain down to a 2, her sciatica down to a 2, which is tolerable. Her oswestry was below 16 or below 20. Our goal is always to get your oswestry below 20. So she still had a little bit of pain, but she was able to live her life normally. That's the key. Anything under 20, you're living your life normally. Okay, she still had some pain. She can tolerate the pain, but we'd gotten her situation stabilized, under control, and she was feeling better. Everything we do is without drugs or surgery. Again, she was severe disability. At the end, she was minimal disability. Almost got her back to 0. Why? Because we directly affect the disc. It's called the evolution of back pain. We've evolved. Used to be just muscles, physical therapy. Then it was joints, chiropractic manipulation. Okay, we treat the disc. It's deeper, it's more advanced, and it's better because we get the outcomes and we solve the problem in the disc. So the lesson today is do not wait to get your back treatment. Do not wait. If you like what you hear, we want you to subscribe to our YouTube channel. We go live every day, sometimes twice a day. We do live because we want to be able to answer your questions as well. So if you like our channel, you'll be alerted when we're going live. And if you share information for your friends or put it in your timeline or your playlist, we're here. We're here to help people. What we do is different. It's better. Okay, we save people from surgery. We solve serious back problems. We get people off narcotics. All the things that you want. We can help you live your life better. Decrease your disability. That's it. Thank you very much. Have a good day. We'll see you tonight.